So welcome to this international conference for integrative medicine organized by Union Yoga Ayurveda Singapore. So my name is Delphine Corbin and I'm a yoga and Ayurveda therapist in France. And I have the privilege today to moderate the session entitled Role of Yoga in Symptom Management in Cancer Patients. And I'm very pleased to welcome Dr. Raghavendra Rao, who will be the speaker for this session. So Dr. Raghavendra Rao is a director of Central Council for Research in Yoga and Naturopathy, Ministry of AYUSH Government of India. He has conducted US study on yoga and pre-diabetes, yoga and HIV with the UCSF School of Medicine in San Francisco. He has written over 80 articles indexed in national and international scientific journals, and he's associated with the R&D at Melbourne and Malaysia in UICC Congress. He has set up a department of CAM at Healthcare Global Enterprise and is accredited by the European Society for Medical Oncology, ESMO, for integrative oncology. So, Dr. Rao, I'm very pleased to give you the words and to welcome you for this session.
Thank you, Delphine. I hope I'm audible to all of you.
Yes.
Yes, yeah, good.
So I'll just go ahead without much ado. I'll go straight to my topic. So I'll be sharing my screen. So good afternoon, friends. It's a privilege to be here among all of you to share my thoughts, my experience in working with cancer patients. I'm a Bachelor of Yoga and Naturopathy physician, and since 1998, have been working with cancer patients and looking at how yoga can be useful in management of certain symptoms which these patients face. So I'd like to share my thoughts, my ideas, and 20 years of research with cancer patients. So today I hold a position in the Ministry of AYUSH, Government of India, the policy making body which also helps in funding such programs throughout the country and across the globe. So today I'll take this opportunity to address all of you and tell you, share my views on how yoga can be integrated in oncology and what is the role of yoga in cancer patients. So I think you must have already heard some things since today morning from the various eminent speakers across the globe from US and UK. So today I'm going to add on to that particular knowledge, looking at what has happened in India and where we are today with respect to yoga in oncology. When we talk about lifestyle diseases, my friends, the very important aspect to understand that cancer falls under the ambit of a non-communicable disease. It is a lifestyle disease and it comes because of chewing tobacco, because of alcohol, because of pollution, because of carcinogens in foods, because of the lifestyle which we follow. So these are three important aspects which are there, which can cause a host of diseases. These are physical inactivity, these are hypernutrition, as well as stress. Though we have clear evidence about hypernutrition, that obesity can increase the risk of getting cancer, for example, breast cancer or ovarian cancer, 6-fold times in women compared to those who are non-obese. We do not have the same yardsticks for physical inactivity or for. Very important to understand is many of the patients did ask me that I don't smoke, I don't drink, but I still have cancer. Okay, It's a very, very important question for us to answer, because they are very truthful, they are religious, they are faithful, they eat only vegan food, no meat, no tobacco, no alcohol, nothing, but still they got cancer. We all need to understand that we only know the causation of cancer for 40%. 60% cancer is caused due to mutations which are aberrant mutations which do occur by chance in our lifetime. Only for 40% of the cases do you know the cause for this cancer. So having said that, we'll go deeper into what is the role of stress in cancer, what happens when there's increased stress, and how do you mitigate this. We know we talk about wellness. When you talk about wellness, we always talk about health. We talk about body's homeostasis. Hence, your metabolism has to be normal, balanced. The number of production of amino acids, depletion of amino acids in the body should be almost equal. The cell turnover, the number of cells dividing, number of cell dying should also be equal. The immune response should also be balanced. You can't have a hyperactive immune response causing allergies or a hypoactive immune response causing cancer. Okay. You also have to have proper regulation of your adrenomedullary axis, your sympathetic nervous system, and your hormone system, which helps in balancing stress, which helps you to confront stress. And last of all, you see, you also have to have proper cardiorespiratory fitness to guide you through this particular stress. So having said that, these four super systems, the metabolic, immune, neuroendocrine, and cardiorespiratory super systems are very, very vital for maintenance of anyone's health. And any derangement in any place would have repercussions for health in other parts of the body as well. So when you have stress, the body reacts to stress in a different way. Okay. So when your body is not properly fit enough to cope with the challenge of this day-to-day stress we take in, okay, then you have a problem. There is a fight or fight response. There is increased overactivation of your pituitary gland to produce more stress hormones, more cortisol from your adrenal medullary glands, and from there, cortex of the adrenal glands, and from there, you start having the cycle of illness which you see on the right side. But when your body is fit enough, you're able to cope with stress in a better way. Your reaction to stress is subdued. Then you have wellness, or your integrity of your homeostatic mechanisms are well maintained. That's what you see on your left side. So if you look at mind-body programs, over several years since 1940s, there are a lot of studies which show about relaxation techniques, which talk about social therapies, social support, supportive expressive group therapies. We talk about biofeedback, humor, tai chi, qigong, emotional expression, expressive arts, and of late, yoga and meditation. It's only in the last 3 to 4 decades that a lot of interest on yoga and meditation has come up, and they have become very, very popular the world over, and they're featured many empty number of times, almost 7 times on the Times magazine as well. Okay. So how many of them do yoga today? So huge number of people practicing yoga. World over, they say about 300 million yoga practitioners, half of them in India alone. The 6,000 plus yoga studios in USA alone, 36 million of them practice yoga in USA alone. It's a $80 billion industry with annual turnover. So how does yoga help? So very important to understand is traditional yoga helps in complementing Western medicine. We talk about lifestyle diseases, okay? And when we talk about lifestyle diseases, we know these are called psychosomatic diseases. So modern medicine mainly talks about acute care, talks about life-saving medicines, talks about emergency care, talks about infectious diseases. But when it comes to chronic diseases, where the causative factors are multifactorial, more to do with stress, lifestyle, nutrition, it requires a constant management throughout life. And this often had poor outcomes. Like you see a diabetic patient, the progression of diabetes worse over time, over the years, with people having to take one medication initially, then taking 2, then taking insulin, etc. So what is yoga got to do here? Yoga can be integrated along with this conventional care and play a very vital role in primary prevention, onset of the disease, as well as preventing complications of a disease. And if you look at popularity of yoga interventions or complementary alternative medicine, it's hugely popular world over. In US alone, 1 in every 3 people take to some form of yoga. Okay, this is a very important aspect which we have come out of certain surveys. So when you talk about yoga, there's so many things about yoga. There's meditation, there are topsy-turvy postures, there are asanas. Okay, and there are various variations of yoga, various schools of yoga. But very important for us to understand is yoga is not about contortionism. It's not a workout regimen. It's not exercise. It's not acrobatics. It is a science of gaining mastery over the mind. Okay, it is science of mindfulness, trying to become aware of what is happening in your mind and trying to control it. Okay, trying to gain mastery over it. And this is a science of calming down the mind. These are all put in the various yoga texts. Manaha Prashamana Upayaha, as Sage Vashishta says, it is science of calming down the mind. Okay, and it brings about equanimity in your approach. Okay, and it brings about skill control of activity according to Bhagavad Gita. So various texts have talked about simple definitions of yoga, and it is not just about topsy-turvy asanas. So why I said this was, many people think when I started my using yoga intervention as early as 1998 with cancer patients, people were laughing and saying, how can cancer patients do yoga? Okay, their definition of yoga was standing on the head. A headstand was called yoga for them. Okay, that's all they knew about yoga during that time. So they said my cancer patients can't do yoga. They have fatigue, they have vomiting, they have nausea, they have poor nutrition, they have so much of symptoms, they have brittle bones, they can't do yoga. Okay, that was what was said in 1998. And gradually there's a lot of acceptance on yoga, and in most of the oncology centers, you have a yoga department now. So how does yoga act? We know very well it helps acting on the hypothalamus-pituitary adrenal axis, cuts off the stress axis, reduces the stress hormones, and reduces your activation of the sympathetic nervous system, brings about a calming down effect on the mind called as a relaxation response, and thus brings about a change in the homeostatic mechanism of your body. So, okay, the various measures and a lot of studies have shown the physiological effects of yoga. Okay, they've shown effects on endocrine system, on immune system, cardiovascular system, nervous system, as well as the musculoskeletal system. Right from bringing about increased flexibility of the body, improving the cardiorespiratory endurance, improving the cardiac output, relaxing the mind, as well as bringing about hormonal balance, yoga can do almost everything in the body to change the deranged physiological system. So let us talk about yoga and cancer and how yoga has played a very important role in cancer. When you start talking about yoga and cancer, when you start looking at PubMed, a huge number of articles on yoga and cancer. Okay, and out of the number of articles, you see 50% of them focus on symptom management. More than 500 articles are there. 50% of them focus on symptom management. And if you see, yoga has become very, very popular in most of the oncology hospitals and most of the medical teaching hospitals and universities in US. Like this is, you can see the Dana-Farber Cancer Center, Osho Center for Complementary Medical Therapies. You can see a yoga class going on, and UCSF on the right side where you have a yoga department there too, a yoga chair there too. And if you see respect to yoga and cancer, you can understand, you can see the number of articles which have been published. Out of 245 articles being published, 76 of them are clinical trials. Like roughly 31% of them are clinical trials. So very, very huge amount compared to Ayurveda, compared to Unani, Siddha, homeopathy, or Chinese medicine or herbal medicine. The percentage of clinical trials of these systems is very, very lower compared to that of yoga. Even mind-body medicine keywords gives you only 23% of the articles which are on clinical trials. Why I say clinical trials are because clinical trials are the gold standard for using yoga or any other system in particular as a therapy. And evidence from clinical trials are considered as level 1 evidence, and that's why we talk about give more emphasis on clinical trials. So what is the prevalence of symptoms in cancer patients? I'm coming to this topic. Fatigue, 90% of them have fatigue, 59% to 60% have anemia, 90% have nausea during chemotherapy, 56% have constipation, most of them so when there is a morphine given to them to reduce pain, 23% have diarrhea, 53% have cognitive impairment, and several others, and this can cause extreme and severe distress in cancer patients. So we tried to do a program in 1998 using yoga as a add-on intervention to conventional treatment, and we wanted to see, by using yoga, can you control symptoms, can you reduce psychological distress, can you reduce mood, improve mood states, reduce perceived stress, modulate cortisol rhythms, improve anti-tumor immune responses, reduce inflammation in this cancer patients, and also modulate DNA damage. So this was a research which spanned from 1998 till 2014, and research studies are still ongoing. Several 5 different studies were done during this period, a very large number of studies. and I'll come to it later on. So my question, earlier question I began was to talk about, did stress cause cancer? So we don't know whether stress causes cancer. A lot of studies which show, which dates back to 1980s, which show that patients who had depression or who had melancholy are women are more prone to get breast cancer. So they were tying up depression with breast cancer. But there is a study which was done in 1991 by, and as well as in 2006 by Anthony and Anil Sood's lab. And they showed very clearly that though we don't know the stress can cause cancer, but we do know that stress can increase the progression of cancer. Okay, there is some animal experiments. They gave a stress to the mouse in one cage. So whenever the mouse went to eat the food, it got a small electric shock. They had injected cancer cells in the foot part of the mouse. Other group also got stress by means of electric shock. They had injected cancer cells here too in the second group of mouse. Third group also did not receive any sort of stress. They were left alone in the cage and were given feeding at normal intervals. So what they saw was the group which received stress or a shock, the cancer progressed much faster. All the 30 mice which was there died within a matter of 15 days, whereas the group which got electric shock, but which was also given a beta blocker, a drug which can help in reducing the effects of stress, which is also called as a propranolol. When it was given to them, the 50% of the mouse survived, showing that stress has got a clear etiology, clear role to play in the progression of cancer. So by cutting off or reducing stress, you could improve survival in the mouse models. Whereas the mouse which did not get any stress, all of them survived. Okay, this goes very clearly to show that from animal models that stress can augment progression of cancer. And apart from that, a lot of studies have been done. There's a meta-analysis on depression in cancer patients, which show that 25% of those which have depressive symptoms and 39% who have major depressive illness have higher mortality rates compared to those who don't have depression. So this is in breast cancer patients, published in 2009. So what are the problem areas in oncology and why we need to use yoga in oncology is very, very important. So if you see, there are difficult symptoms: fatigue, loss of appetite, constipation, dry mouth, xerostomia, neuropathy, and bed sores. These are some of the important things which are very significant complications in cancer patients, and we don't have much solutions in allopathy to combat them. And if you look at other complications, oral mucositis during radiotherapy, chemotherapy-induced nausea, vomiting, low blood counts, then quality of life, physical well-being, emotional well-being, and disease management, malignant wounds, reducing treatment side effects. So these are some of the important areas which are challenges which an oncology patient as well as a doctor needs to face. Okay, the doctor, in the sense, patients will always have difficult symptoms, worsening of symptoms, too much of distress, and you need to take care of them. This is very, very important. Apart from trying to use radiation, chemotherapy, and surgery to kill the tumor cells, there is a very thin line between killing a patient and making the patient hale and healthy. So if we can mitigate the stress, mitigate the distress in the patients, reduce the treatment-related side effects, and give a good treatment to the patient, they will survive for a longer time. Okay. And if you see Cochrane reviews or evidence for these therapies, you can see yoga has huge number of evidence. There are about 146 Cochrane reviews in yoga. In cancer alone, there are 8 Cochrane reviews. You can't find those kind of Cochrane reviews in any other system of medicine, alternative system of medicine. So we'll look at yoga in oncology. The first thing was on surgery. So we looked at breast cancer patients, newly diagnosed breast cancer patients who are undergoing surgery followed by chemotherapy and radiation. Okay, this is a 6-month treatment. You have surgery, you have 4 weeks intervals, follow it with chemotherapy 6 cycles to 8 cycles, then you follow with radiotherapy. Okay, these patients were taken up through this particular cycle. One group received yoga intervention, other group received a conventional treatment alone. So one group received yoga with conventional treatment, other group received conventional treatment alone. We looked at wound healing in surgery, looked at immunity, inflammation, cytokines. We looked at anxiety states in patients undergoing surgery. We looked at mood states, nausea, emesis, and fatigue during chemotherapy. We looked at speech articulation, fatigue, and myofascial pain during radiotherapy. We looked at pain management. We looked at immune response. We looked at quality of life and fatigue. And I will talk to you about some of these studies which have been published in international journals. So if you look at research evidence for anxiety, depression, 141 studies are there using yoga intervention in cancer. I won't go into other studies as much for anxiety, and 136 studies are there for depression. And what we saw was in our study, which has been published in Indian Journal of Palliative Care, we did both studies on early breast cancer patients as well as metastatic breast cancer patients. And we saw that yoga can improve mood states, improve quality of life, reduce toxicity in breast cancer patients receiving conventional treatment. Okay, and our studies in the meta-analysis have also been quoted in meta-analysis studies where they are shown very clearly that the results obtained in our study, which you can see on the highlighted in the red rectangle, are almost similar to that obtained by other studies done elsewhere. So this goes to show that our study results are more reproducible and robust. Okay, so let us look at the role of yoga in fatigue. So fatigue is a very, very important aspect of cancer patients. 90% of them patients experience fatigue, and when patients say I have fatigue, all the doctor says is take rest. Okay, they say you have fatigue, you take rest. That's all. There's no solution to fatigue. So this is very, very important that we need to manage in cancer patients. It's a very, very important and dominant symptom of patient because fatigue greatly affects quality of life of the cancer patients. So we teach more of back bends, we teach more of breathing exercises, we teach more of asanas. Okay, and we help in stretching. More of stretching is given, asanas are given, which helps in strengthening the muscles, reduces the muscle fatigue, which improves brings about energy conservation, etc. in the body. So we'll not go into deeper about how does it help in fatigue, but what studies have shown is that increased oxidation of tissues is facilitated by yoga intervention, decreased muscle fatigue happens, and there's increased muscle strength. Okay, it also helps in reducing inflammatory cytokines like IL-6, which are known to cause fatigue. Okay, so all these are some of the mechanisms by which yoga acts, and now yoga for fatigue is a very, very important part of the guideline by Society for Integrative Oncology. So this is study 2, which I worked on patients who are receiving adjuvant radiotherapy following their surgery. These are breast cancer patients, stage 1 to 3 breast cancer patients receiving radiotherapy after chemotherapy, and they received radiotherapy for 6 weeks, came to the hospital 5 days a week, and during their 5 days a week visit to the hospital, every day before radiotherapy, they received yoga intervention for about an hour. Okay, and what we saw was the fatigue levels, severity of fatigue came down drastically in the yoga group, the green ones. The frequency of fatigue in the overall in the day also came down in the yoga group. Interference of fatigue with the normal day-to-day activities also came down in the yoga group, and there was variation of fatigue also came down. And this has been published in Integrative Cancer Therapies. We also looked at, during the same study, we saw that there's improved quality of life in yoga group compared to controls, improved cognitive function in yoga group compared to controls. Okay, there's no mental fatigue. The physical fatigue and mental fatigue also came down. Improved social functioning, and improved quality of life, indicating that patients were able to go out, they didn't have fatigue, their quality of life was almost normalized. Okay, what is the mechanism of fatigue? So we all know that early morning when you get up, you feel a lot of pep, you are very pepped up with a lot of energy in the morning, and you are very, very active. That's because of the hormone called cortisol. It's very high in the morning and it tapers down in the evening or in the night time. So what happens in cancer patients is because of the constant stress and distress they experience, this cortisol stays high throughout the evening as well, and it stays flat or it goes up high up above in the evening as well. And when the cortisol levels increase, this can cause sleeplessness, this can cause insomnia, and this lack of sleep in the night will cause daytime sleepiness and can also cause fatigue. So it's like a vicious cycle. So what we saw was, we saw effects of yoga on sleep quality and neuroendocrine immune response in metastatic breast cancer patients with advanced cancers, published in Indian Journal of Palliative Care. And here too we saw the cortisol levels in the morning came down drastically in yoga group compared to controls after intervention. So for this group of patients, what we did was, early morning, 6 a.m. we took saliva, 9 a.m. we took saliva, and 9 p.m. we took saliva on the same day for 3 consecutive days before radiotherapy and after radiotherapy. And after taking this, we did a lot of assessment. We did a mean cortisol slope, and we saw that the morning cortisol peaks, which are there in patients who have cancer, came down drastically in the yoga group compared to controls. Okay, this is also published in a very important, a very big journal called Integrative Cancer Therapy. Okay. Next one was the effect of long-term yoga practice on psychological outcomes in breast cancer survivors. So we had a cohort from 1998. We followed them up over the last 10 years and looked at effects of yoga improving mood, fatigue, sleep, as well as on cytokines. So what we saw was patients who are doing yoga, who did some form of yoga, had better quality of life, improved mood states, improved sleep, and reduced fatigue. Okay, and also had lower inflammatory cytokines. There's another study which we did was on yoga and nausea, vomiting during chemotherapy. So we developed a yoga module which is about 20 minutes, which can be done on the bedside when the patients take chemotherapy. And we looked at using yoga intervention to see how does yoga help in modulating chemotherapy. When you give chemotherapy, there is nausea, there is vomiting for the patients for first week, and it is progressive. So patients are put on antiemetics. Patients are given steroids to take care of the nausea and vomiting for first 3 days. But you can suppress vomiting, but you can't suppress nausea. Because you suppress vomiting, there is nausea, there is anorexia, loss of appetite in cancer patients. So this anorexia and nausea is because of decreased gastric motility. Because you are giving an antiemetic, it reduces the gastric motility, and the feeling of the vomiting sensation comes down. The vomiting comes down, but the vomiting sensation still persists. Okay. So what we did was we did a yoga module which had simple asanas to be done in the bedside, like Bhujanga asana, Pavana Mukta asana, Uttana Padasana, and quick relaxation technique and breathing exercises, Shitali Shitakari Pranayama, where we saw that by doing this 25-minute yoga module, compared that with the relaxation technique, we saw surface electrogastrogram activity, the gastric motility activity, and the heart rate variability. And what we saw was normalization of the gastric activity and the motility by third cycle of chemotherapy in the yoga group. Okay, and this is a very important finding, saying that the gastroparesis induced by medicines can be taken care of by using a simple yoga intervention at bedside for chemotherapy patients, and that's how you can take care of nausea, vomiting in patients. And this was given a ASCO Merit Award in 2013 by American Society for Clinical Oncology. Next one was look at decrease in psychological distress, and we saw, and there's a meta-analysis. It's also focused on our own publication, and where they showed very clearly that our studies, the decrease in psychological distress was similar across other studies which are done elsewhere in US and Europe as well. So we're coming to post-operative outcomes. We are talking about drain retention. So after mastectomy is done, the breast is removed. The patients are put on a drain to remove the seroma from your axilla. Okay, and this can impact the duration of hospital stay for the patients. And if it gets infected, it will delay the suture removal. It can cause post-operative complications. So we looked at all these aspects, and we saw the wound healing. The duration of suture removal for patients undergoing yoga was less than by 2 days compared to controls. And the immune cell outcomes, the NK cell activity, anti-tumor immune response was better in the yoga group post-surgery and post-chemotherapy compared to the control group as well. Okay, so we saw how does yoga help in immune response. So we know when you give chemotherapy, when you give radiation, you cause damage to the cells of the immune cells inside the body. So there is what is called a damage to the DNA, and the damage to the DNA is seen as tails on a comet essay. Okay, the length of the tails signifies how much amount of damage has happened to the DNA. The tail length tells you how much DNA in your cells have been damaged. And we saw the DNA damage before and after radiotherapy, and we saw that in yoga group there was a damage after radiotherapy as with all the findings, but the damage was lesser in the yoga group compared to control group, and this was significant and published in Integrative Cancer Therapies as well. Okay, how does it help in how does it reduce DNA damage? So cells have an inherent repair capacity. When the DNA is damaged by radiation or chemotherapy, cells have the repair capacity to repair the damage. So yoga acts by improving that repair capacity. That's what we found out. Okay, and if you see now, there's a lot of endorsement for using yoga interventions as a practice guideline, and this has already come out in the ASCO guidelines as well. And I was fortunate to set up the first European Society for Medical Oncology Certified Integrative Oncology Department at Healthcare Global Enterprises. This is a chain of cancer hospitals across India. We have about 27 of them, and we integrate yoga into cancer care. And since 2007, we have done 10 research studies, 35 full paper publications, 16 ASCO abstracts, 1 ASCO Merit Award, 1 ESMO podium presentation, and 2 USCC workshops. The level of evidence is very high for integrating yoga in oncology, and I don't see any reason why this can't be integrated in various hospitals in Singapore as well. Okay, so any questions?
Thank you very much, Dr. Rao, for this great presentation. Really, congratulations for all this research you have done, all this huge work you have performed for yoga and cancer. So let's take questions now and move to Q&A session. So I have one question from Maya. The question is, what are the yoga asana for breast cancer?
This is very important for you to, it's a very good question you have asked from Anuradha. What I would like to tell you is there is no asana for different cancers. You don't have a specific asana for breast cancer, a specific asana for a brain cancer or a pancreatic cancer. The asanas which you do depends upon the symptoms the patient faces. The kind of goals of the asana is very, very important. Now, why are you doing this particular asana for this particular patient? This is very, very important. For example, when you do surgery, so I just showed you an example of a mastectomy. You have tightness in the breast, you have a suture, you have a collection of fluid in your armpit after surgery. So if you want to do the asana during that time, you have to concentrate on hands in and out breathing. You have to concentrate on yogic breathing. You have to concentrate on Bhujangasana, which can help in improving the drainage of the seroma from your axilla. Okay, so each asana you do is specific to the condition which you want to address. For example, during radiotherapy for head and neck cancer, for oral mucositis, there is speech defects. There's defects with articulation. So you want to improve the articulation of the patient. You want to reduce the fibrosis inside your oral mucosa. Okay, you want to stretch your muscles. So you have to do those kind of asanas, Ujjayi pranayama, Shitali Shitakari pranayama, neck rolling, neck exercises, Bhujangasana, Gomukasana, etc. for head and neck cancer for speech articulation. So it is all issue specific, based on the symptomatology, based on the goals of what you want to desire with a patient, and it's never based on a type of cancer, because all cancers, each cancer, the medicines, the treatment are different, the side effects are different, and your intention should be more towards taking care of the problems of the patient with that particular cancer rather than the cancer alone. Cancer is taken care of by your chemotherapy, radiation, and by your surgery. But all you are going to do is to see how you can take care of those side effects and those symptoms.
Thank you, Doctor. So, Doctor, I have a question from Jose Crane, Rose. Do you often see HPA dysfunction in cancer patients before treatment has even begun?
Yes, it is very, very evident in cancer patients. So you know that once you have diagnosed to have cancer, they have a lot of anxiety. They also undergo a lot of distress and depression as well. And because of the psychological stress, they do tend to have HPA axis dysregulation. Even before doing a surgery, they can't sleep overnight the previous day of surgery, or even a few days before surgery as well. I had a patient of mine who used to run away from the hospital on the previous night of surgery. She did that almost for 3 times. Okay. Finally, we had to call her, we had to counsel her, and it took me almost 2 weeks to get her calm down and make her go for a surgery. And this lady had too much of bouts of insomnia. She could not sleep. She was completely restless, completely agitated. Too much of fatigue and too much of distress was there. And this is a very important problem which we see in almost all the cancer patients, especially those who don't accept their diagnosis and those who feel more helpless and hopeless about it.
Okay, thank you. There's more question. So question from Jenny Yap. How does yoga improve cells healing capacity?
See, yoga, what does yoga do here basically is, for example, when you give a chemotherapy, so there is a lot of destruction of cells. So the lining of the gastric lining is completely ripped off, causing nausea and vomiting, causing diarrhea, etc. So the amount of damage exerted by your chemotherapy treatment, your radiation and surgery is enormous. Okay, and they not only kill the normal cancer cells, but they also kill the normal cells in your body also. That's the reason why you also have low blood counts in cancer patients. Often the cancer patients have to receive blood transfusion to take care of the blood counts. So I also showed you one slide where there's increased DNA damage with radiotherapy. So what we have seen here is when you have too much of stress, the stress hormones go up very high. And when the stress hormones go up very high, they potentiate the amount of damage to the cells. They increase the amount of damage to the cells. They increase the cellular destruction. They cause more inflammation. Now what does yoga do is, it reduces the inflammation, it reduces the cortisol levels, it reduces the amount of damage happening to the cells, and it also improves the inner healing capacity of the cells to repair that particular damage. There's a reason why you can see that the amount of patients having low blood counts with the yoga group was lesser compared to those who did not do yoga. So there is a self-healing capacity inside the body to repair the damage caused due to chemotherapy and other agents. So yoga works in that way. It has a self-healing capacity.
So there's a question from Aileen. What about for someone who is having continuous diarrhea after chemotherapy? What's good to do?
So this is a very good question. It depends upon the type of chemotherapy the patient has received, and the diarrhea usually lasts for about days together. Okay, there are some medications which also have to be taken. Along with that, nutrition plays a very, very important role. Okay, because what happens here is in diarrhea, you will have a loss of potassium, loss of sodium, etc. And if you don't correct nutrition, and if you start doing yoga, you will have cramps in your legs, you will have cramps in your body. Okay, first thing is to correct the nutrition imbalance, the fluid imbalance, the electrolyte imbalance which happened because of diarrhea. After that is done, you need to do asanas which can reduce your gastric motility. Okay, especially if you keep your legs on your, if you're doing Viparita Karani, the topsy-turvy posture, just like Sarvangasana, you take a wall support, lean your legs upward, vertically upward against the wall, and do slow deep breathing with it. So Viparita Karani breathing for about 10 minutes will help. Taking fenugreek seeds, methi seeds, methi decoction will also help in reducing gastric motility. There's some small kitchen remedies which can also be followed up along with this, and we have seen that it helps a lot. Okay, for patients with diarrhea during chemotherapy. Okay, some patients also receive buttermilk enema as well. I've seen that, and they do well with that.
Thank you. Next question from Shirley. How often is yoga practice recommended during chemotherapy?
Yeah, it's a good question. So usually on the day of chemotherapy, we teach different types of practices. So we don't do more of asanas there because the patient undergoes chemotherapy infusion. They have severe fatigue in the first 3 to 4 days. First week after chemotherapy is usually patients are usually bedridden, they have malaise, they have fatigue, they can't function. So just during that time, we give them more of relaxation technique, more of breathing exercises to improve the oxygenation of the tissues and lungs to take care of fatigue. Okay. So what we do by yoga here, when you talk about yoga in cancer patients, our yoga is for very, very short duration. It can be for 10 minutes, it can be for 5 minutes, you can just do one single practice, you can do one relaxation technique. So you keep doing it at different regular intervals. Okay. We never ask them to do one yoga session, one session for about an hour or so. It's very difficult and practically impossible to do that when the patients are taking chemotherapy, especially in the first week. So we just give simple practices which are important to reduce the nausea, vomiting, or to take care of fatigue, depending on what symptoms they have during chemotherapy. So first week. Second and third week, they can slowly increase the duration of practice. So at least practice once or twice a day. Okay, a small practice about 15 minutes is enough. Okay, you don't need to do a 1 hour practice. Just enough to take care of your symptoms.
Okay, very interesting. Thank you. Next question from Svitlana Dapisa. My friend was recently diagnosed with a brain tumor. What is a yoga practice can help him during treatment?
Okay.
And what kind of yoga practice can be used to prevent brain tumor?
Okay, for the first question, what kind of practice can be used with brain tumor? So what we have seen here is with the brain tumor, especially like astrocytoma or glioblastoma multiforme, different variations of tumor, and usually often patient undergoes surgery, undergoes radiotherapy to the brain. Okay, and that is where very, very important for us to understand when you have these kind of treatments, there is a lot of fluid accumulation in the brain, increased intracranial pressure as well. So during that time, you asking a patient to do yoga is very difficult because they have severe headaches. They can't concentrate, they can't do that. So simple thing is to give guided relaxation techniques, to give them to do a lot of deep breathing techniques. So these are very important techniques which patients can do with a brain tumor. So we don't give any other technique apart from this. So we just give more of guided relaxation and more of breathing techniques. And in case if they tend to have weakness of your legs and arms because of the brain tumor, we start doing hands in and out breathing. We also teach them passive asanas. Passive asanas in the sense you have an instructor sitting and making the patient do the asanas because there will be weakness of your arms and legs as well. Okay, so that is one thing which can be done. And the second one, preventing brain tumor. It's a very dicey question. Again, the cause of brain tumor, a lot of things are related to genetics. Some of them are also related to mobile radiation and other things, but we don't know the exact cause of this. So to answer this may be very, very difficult. We require more studies to say that whether yoga can really prevent brain tumor.
Thank you. Next question is from Ermilda Gemain. My mom has her lymph nodes and breast cancer. She was asked to do the extra 12 chemotherapy for maintenance to avoid relapse. It was an option, but she decided to take it. Will yoga help her to avoid from relapsing?
Certainly, it's a good thing that she has taken chemotherapy, because once the cancer has spread to the lymph nodes, so it's very important for all of you to understand about cancer. It's not that yoga can really help in curing cancer or kill the cancer cells. We don't know for sure whether yoga can really do the aspect of killing tumor cells. We've not proven that as yet. But what we know is that yoga can boost up your immune response against cancer cells. Now, having said that, let me tell you about tumor itself. The tumor or the cancer has a mind of its own. Okay, it can produce its own blood vessels. Okay, and the blood vessels which it produces are abnormal blood vessels. These are porous blood vessels, and these form clots easily within the tumor. Okay, so initially scientists, when they found out that there are a lot of blood vessels inside the tumor, they thought that they can give chemotherapy. The chemotherapy can go into the blood vessels, go into the heart of the tumor, and kill those cells. But they were wrong. Why they were wrong was, they found out that these blood vessels were very, very porous. These formed blood clots very easily, and because the blood clots were formed inside, the amount of chemotherapy drug entering into tumor was very reduced. And in fact, within the cancer ball of cancer itself, there were areas which had too much of ischemia or hypoxia, means decreased blood supply. And that is a stressful area for the cancer to become more aggressive, okay, and more intolerant to chemotherapy and more dangerous. So it is creating a ecosystem of its own, where it learns to evade immune response, where it learns to evade response from chemotherapy. Okay, so it is a very, very different complex process. So to say that only yoga can help in killing cancer is a no. Probably after the cancer has been removed from the body, the only way cancer can be taken care of is when it is operable, when the whole tumor per se can be resected from the body, because the 1 gram of tumor has got 10 million cancer cells. That's a million cancer cells. So if you have a very huge ball of tumor, the huge number of cancer cells are there. So this becomes overwhelming on the immune response to fight against the immune system, and they can win over the immune response. So you are trying to do chemotherapy, kill as many cells as possible, but during chemotherapy, the cancer cells can develop resistance to chemotherapy. They can mutate as well. So cancer has a mind of its own. It's not just having yoga here. Now, having said this, you have to understand two things here. When you give chemotherapy, the chemotherapy not just kills the cancer cells, but it also triggers the neighboring cells to become favorable to the immune for the cancer. It triggers an environment which becomes very favorable for the cancer cell to again grow. In a sense, it triggers inflammation. It activates a nuclear transcription factor called NF-kappa B, both in the cancer as well as in the normal cells. So when it can kill the cancer cells, it activates NF-kappa B or inflammation in the normal cells, and this inflammation is a signal used by the cancer to spread and proliferate. But what yoga can do is, by using yoga intervention, you can reduce inflammation, reduce inflammatory signaling, and probably curtail the growth of or spread of the cancer. And this can only happen when most of the cancer is removed from the body, and you have very small micro metastasis, very small remnants of the cancer which you don't know whether it is there. You can't see them on a PET scan, you can't see them on anywhere. Okay, but you know that there are some tumor cells circulating inside the blood. So when you have very small amount of tumor cells left behind after chemotherapy, you give yoga intervention, you change your lifestyle, you take proper diet, reduce your stress, probably you have a better chance.
Thank you. Based on my practice as yoga therapist, what I observed with cancer patients is that it's very difficult sometimes to make them compliant of yoga therapy session. and most of them will cancel the session because of chemotherapy's side effects. They are too weak or too many side effects, nausea, vomiting, and so they just cancel the yoga session. So what is your experience, and what would you recommend? What are your tips to provide to patients?
So that's a very important question. And as I said to you earlier, having a very, very short module, okay, very short module, 5 minutes, 10 minutes module is one which is going to really help you. And you also identify what is the major symptom bothering the patient. Like for example, if you said nausea and vomiting is the main symptom bothering the patient during chemotherapy, you do Shitali Shitakari Pranayama, you do Pavanamuktasana breathing, you do Bhujangasana breathing on the bed. So just a mixture of 1 or 2 asanas and breathing and pranayama exercises, that's enough for the patient. And then do relaxation technique. Okay, a short module for about 15 minutes is enough for the patient. You try to take them for a long module for 1 hour, half an hour, it will never work with the patient.
Thank you. Thank you. That's very useful. Next question is from Leigh Leibel. For a patient with complete colon cancer remission, what yoga practices are recommended to prevent cancer from reoccurring again?
Yeah, if the patient is already under remission, that's a very good news for us because hardly there's any tumor load. So just general yoga practices, okay, with a lot of breathing exercises, more of relaxation techniques. You should understand what is yoga. Yoga is not just a physical exercise, okay, though it is not an exercise effect. It is more to do with the mindset of the patient or mindset of the person who's doing yoga. So you need to totally change the mindset of the person. How do you change the mindset of a person? You need to change, he should learn to accept that he has cancer. He should learn to accept that he's already conquered a 1 hour cancer. And he should learn to see what he can do to take care of cancer. Okay, the state of self-responsibility, what I can do to kill my cancer. Now the chemotherapy has killed my cancer cells. Surgery has removed most of my cancer from the body. Now what can I do to harness my immune response? So he has to be more responsible in maintaining his lifestyle, more responsible in taking his medicines properly, more responsible in going for regular checkups, okay, and more responsibility towards self, trying to see that he's very calm, he's relaxed throughout, doesn't get agitated, doesn't get emotional, learn to find out how does he react to stress, what is causing him stress, or try to understand how is he reacting to stress, try to see how he can mold his personality, change his personality for the better. Okay, so that is what is yoga. It is not just giving a yoga module or going to a regular yoga class is yoga. Regular yoga class can bring out physical fitness, has an exercise effect. It also has anti-cancer properties, but much more than that, changing the personality trait of a patient is very, very important. I'll give an example of one of my patients diagnosed with stage 4 breast cancer. She had a 3 centimeter lump in her breast, on the right breast, and she had a 2 centimeter lump in her lung. So the breast cancer had metastasized to the lung, right lung. So she received chemotherapy, she received cyberknife radiorobotic surgery for the lung lesion, and then she received surgery for the breast, okay, following this. And this happened in the year 2008, okay, almost 12 years back. And during that time, she had consulted several oncologists, and they said, you have metastatic cancer, we have to give palliative chemotherapy, we can't do much, we can't guarantee you whether the chemotherapy is going to work or not. If you see metastatic breast cancer, the survival rates are quite low, only about 10 to 15% of them survive for 5 years, most of them die within 5 years. That's what the doctors were saying to her during that time, during 2008. But when she started taking this and started doing yoga, she was a very anxious patient. She completed the treatment. She started doing regular meditation, started doing yoga, started changing her diet to a vegan diet. Okay, she started keeping weight over body weight, watch over her body weight. Okay, she did everything to modulate her lifestyle, and she started becoming very, very happy. She had too much of stress in the family. She learned to manage the stress, and God's grace, that's what she's still alive today without cancer. Okay, so there are some things which can happen which we can't even tell. But whereas the same thing in some patients it may not really work. But most of them I've seen take up good lifestyle when they're doing remission and who are responsible for their health. They do much better than other patients who don't do that.
Thank you. We have several questions from the audience about diet. Questions are about on diet front. What are the foods that cancer patient or recovering patient should take more, and what to avoid?
So a lot of studies have shown that taking a high fiber diet is beneficial for cancer patients because it can reduce the chance of relapse or recurrence. So reducing on the red meat, reducing on unsaturated foods, unsaturated fatty acids play a very important role. And taking more of high fiber diet, more of fruits, more of vegetables, they're all very, very useful for the patients. And along with that, the food should be a balanced diet. Along with that, you should also see with physical activity. Being physically active along with the proper nutritious diet, both of them go hand in hand. It's not just about food or about diet. So it should be a total lifestyle change which somebody has to adopt. Taking small meals and don't trying to be taking early dinner almost around 6 o'clock, 7 o'clock in the night, and trying to take a later breakfast. Having a brunch in the 11 o'clock in the afternoon. Okay, so try to keep your body in a fasting state for about almost 16 hours. That is supposed to be very, very beneficial for patients. So a lot of studies are going on in this area where they're saying that if you give rest to your body, your body has a chance to heal faster, recuperate faster. The immune response is better in these kind of people who do fasting for about more than 16 hours per day. 8 o'clock in the night to 12 o'clock in the next afternoon. So that's the kind of thing which people need to follow. So having 2 meals in a day or having smaller meals, okay, and doing this kind of a fast may be very useful for patients.
Okay. And how often would you recommend to do fasting for this patient? Is it every day or once a week?
No, it should be alternate days or once in 3 days, depending on the patient. And again, it depends upon the nutritional status of the patient. So before you start putting on a fasting therapy or a nutrition program, you need to get them assessed for all the nutritional deficiencies, correct those deficiencies, and then go ahead with this. Because some of the medicines which patients take, like you may take aromatase inhibitors, you may take letrozole, other hormone therapies for a longer time, and apart after the chemotherapy also. These can also cause low calcium levels, increase calcium turnover, reduce calcium turnover in the bones, and can cause the bones to become brittle. So looking at what therapies they're already taking, okay, is also very, very important because they can cause nutritional deficiencies. Correcting these nutritional deficiencies also is important. And thereafter they can do fasting, a half-day fast or overnight fast, as I said to you, once in 3 days or once in 4 days.
And in cancer patient, would you recommend to practice Kriya by doing detox? Is that useful?
Kriya may be useful only in some situations. I usually don't recommend Kriya because during treatment you should avoid Kriya as much as possible. Because during treatment, for example, when you give chemotherapy, there is a destruction of the gastric lining, and by forcefully doing Kriya like Vaman Dauti or Shankar Praksharana, you may cause bleeding. Okay, that's again a problem. And you also should be very, very watchful if they are taking any blood thinners. You have to avoid Kriya. Okay, especially because with all the treatment which they have undergone and with all the blood thinners they are taking, you can have bleed somewhere. So this is again a very, very important aspect. So you have to be watchful for the clinical condition of the patient before you advise Kriya.
Okay, thank you. About fasting, there's a question from Ermilda. Fasting, does it mean no liquid at all?
Fasting means more liquid. So fasting doesn't mean that you are completely exempted. So if you do overnight fast, you can just drink water and nothing else. You can have lemon along with water, lemon with honey, lemon with jaggery or something of the sort. Don't take refined sugars. Okay, that can really help. So it can be a liquid fast.
Dr. Rao, I wanted to ask you a question about your experience as yoga is perceived as an holistic science in countries you worked, as you have an international researcher. How do you perceive, do you think now yoga is understood as a holistic science, and is it well accepted in hospital to practice yoga therapy for patients? for cancer patients?
Yes, it's a very good question. If you see in US, all the major medical teaching hospitals in US, UCSF, Mayo, Harvard, Dana-Farber Cancer Institute, MD Anderson Cancer Institute, Banner Health Foundation, all the major institutions have a yoga department. Okay, so there's integrative medicine, which is very well catching up in US, and a lot of people are turning to integrative medicine, integrative health, and yoga is very important and is in the forefront of the integrative medicine program. So there's a lot of acceptance, wide acceptance for yoga in US, but the same cannot be said in much in Europe or UK. But you also see a lot of acceptance by patients themselves in India as well. So when I was doing a study among our own cancer patients, when I was studying in a cancer hospital before, working in a cancer hospital before, so we did a small survey of patients. So we saw the patients who are newly diagnosed with cancer and patients with advanced cancers as well. Those newly diagnosed with cancers, 25% of them take recourse to AYUSH therapies, Ayurveda, Yoga, Unani, Siddha, Reiki, pranic healing, acupuncture, homeopathy, whatever it is. Okay? And in that, 50% of them didn't tell their doctor that they are taking this. So, irrespective of the doctor advising the patient to do this or that, so patients, when they have cancer, they make their own judgments, they make their own choices when it comes to treatment. So they may take these treatment, along with that they may also take yoga and other things as well. So acceptance of yoga in India by oncologists is not so great. It is only in some centers where you have a yoga program, dedicated yoga program by qualified experts being given to. So there needs to be a lot of change in the policy as well, and that's going to happen very shortly. And once we change the policies, and probably using yoga intervention as a part of therapy becomes a norm in our country like India as well.
This would be great. I think it was the last question. It's now time to end this session. I really would like to thank you very much, Dr. Raghavendra Rao. It was a very great session, very interesting, lots of information and very useful for all of us in our practice. And I would like to thank also the audience for all your questions and for being here today. So I wish you, all of you, a very good day and namaste.